Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Pamela Buchanan. She's a family physician. Today's Kevin MD article is The Hidden Cost of Neglecting Self-Care, the Autoimmune Connection. Pamela, welcome to the show.
Kevin, thanks for having me. I really appreciate it. I've been watching for a long time.
All right, let's start by briefly sharing your story and journey.
So, my story, I talked about it in a TED Talk, but I grew up wherein I was neurodivergent. I am neurodivergent, and people would often question my mother as to whether or not I was slow. She was before her time, so she got me tested, advocated for me, and found out that I was actually gifted. And from that point on, I was able to learn differently. And so I learned differently. I then went to medical school. I enjoy medicine. I do have a short attention span. I have ADHD. So I have family practice, but I gravitated towards doing emergency medicine. And I work now in emergency medicine. I I think I kind of got to this point because during the pandemic, it was kind of rough. I work
Mhm.
in St. Louis, just outside of St. Louis, Missouri. It's at about an hour. It's a rural area. And so the pandemic hit harder out there. It's usually one doctor working one facility. And so it became overwhelming, became stressed, suicidal, depressed. I've never had that before. And so I realized at that point how hard it is for people to get help and how important it is to get help for your mental health sake. Also, a colleague of my time, he committed suicide.
Mm. So tell me more about the challenges that you faced when you felt these behavioral health challenges. You said it was so difficult for people to find and get help. How did you manage that?
You know, I used to be a doctor who was quite annoyed when people came to the ER over and over for their mental health issues. I was like, this is not the place for that. And the reason I said that is because I thought people could just go see their psychiatrist, go see your therapist. But I found in my own journey that it's quite difficult. When I needed help, I called multiple places. Nobody was taking patients or they didn't take my insurance. What I ultimately ended up doing was paying out of pocket. And I'm just blessed that I could afford to. I don't think I would be well if I couldn't pay out of pocket.
And how are you doing today?
I feel great. I'm doing good. I've learned how to set boundaries. I've learned the tools to actually be happier, to be calm, to accept things, and to set boundaries to make things better for myself.
You tell more about your story in your Kevin MD article, The Hidden Cost of Neglecting Self Care, the Autoimmune Connection. What's this article about for those who didn't get a chance to read it?
Well, I began to really explore self care during my journey with having depression and suicidality. I never thought about it because we're doctors. We just go, go, go. We do, do, do. And during the pandemic, the world needed us. And I never got COVID. So I worked probably a lot more than my colleagues. Someone went down with COVID. I feel the shift. And also, you had the stressors dealing with your family. I have a son who has an autoimmune disorder. So I was terrified that I would give him COVID and kill him. So, all these stressors. So I learned that I had to figure out what was important for me to be okay. How how I could reset, how I could release, how I could, you know, could I continue in this job? Was it good for me? So I explored all those things and I realized that I needed to work less, that I didn't need to work as much as I did, and I could say no. And it's hard because, the hospital will call, say, we have nobody. So saying no is hard. I learned to do that. I learned to be present, not in the past or not in the future, just today, being with my family is important. So I figured out what is important to me, do those things, and anything that falls outside of that is not imperative. I'll do it if I can.
In your article, you note a connection between stress and trauma and the development or progression of autoimmune diseases. So, talk more about that.
Oh, this was eye opening. I read something by Dr. Maté,
Hmm.
and he chronicles how there are some people who have a gene, and that gene is just there, just dormant until it's activated. So you may have a gene for an autoimmune disorder, let's say rheumatoid arthritis, and then it's activated. And one of the things that activate is stress.
Hmm.
And so, and actually, repetitive stress, they call it a weathering effect. And so I was like, oh my gosh, that's me because I have issues and joint pain. And when those stressors come, I feel bad. And also, there's the stats. There's the stats that are undeniable. There are the stats. The stats are undeniable that women have more autoimmune diseases than men. 80% of autoimmune diseases are in women. But it is it makes sense because women often are people who are more stressed than their counterparts, meaning they work plus they take care of the home. I know that's true for me. And then also with my extended family, I am the one who takes care of a lot of things. And even so, more so, past just women, African American women or Black women tend to have even more autoimmune diseases. And so I really thought that was an important point that people need to know so that we can do something about it. When we have things that we can do something about, we have to tell them as physicians and responsible members of society.
And with the progression or worsening of your autoimmune conditions, you said you felt bad. Specifically, what kind of physical symptoms were you feeling that was worsened by the stress that you were experiencing?
So relationship stress, work stress, those type of things led to a lot of joint pain, just achy everywhere, extreme fatigue, and stomach cramps. But my main issues were the extreme fatigue and joint pain. And before I was taking medication for it. But when I learned to modulate my stressors, that became less necessary.
And with the connection between stress and autoimmune diseases, are there any specific autoimmune diseases that are particularly sensitive to stress, or is it just the entire spectrum of autoimmune diseases?
When I read Dr. Maté's work, he didn't say any specific ones. He just grouped them all, generally speaking, rheumatoid arthritis or, Crohn's disease, lupus, those types of things.
And then when you sought out behavioral health to manage some of the stress that you're experiencing, tell us about that. And did it improve your physical symptoms from the autoimmune diseases?
Yes, because learning how to manage your emotions and learning how to deal with stressful situations in a healthy way instead of internalizing them. So Dr. Maté talks about you internalize those bad feelings in your body. You
Mhm.
internalize that stress in your body. So what I learned to do is to own my feelings. I learned to feel what I feel and not to just lock it away. So if I'm upset with my partner, I say, honey, I'm upset, and here's why. If I'm upset at work, I tell my director, I'm upset, and here's why. And I want to know if there's anything we can do to rectify this. And it's a good time right now to be a doctor because more than ever, hospitals are short. There's a shortage. And
Mhm.
so they're more receptive to our needs. And so I have tailored a working and work shifts that fit my life. In general, I work Tuesdays and Wednesdays, and that's it. You call me for a Thursday shift, I'm likely to say no because that's my boundary, and that's what kept me healthy.
Let's talk about setting boundaries. And this topic has often come up in my prior episodes when we talk about things like stress and burnout. And one of the common themes that I encounter is that physicians need to be more firm in setting boundaries and in saying no. And that's not something that's inherent to our training. So tell me the process that you took to set those boundaries. How difficult or easy was it for you? And tell us the thought process in terms of coming down with those boundaries.
I went through my therapist to try to figure out what kind of person I am and why do I do what I do. And so a lot of times I'm people pleasing. And that means I'm people pleasing because I feel rejection from my childhood, being neurodivergent and being made fun of. And so in my adulthood, sometimes I would lean towards that. And so once I realized that, it opened my eyes. I don't have to do that. And then I made a list. What are the things that make me happy? And what are the things that I need? So those are the things that I have to do. And I prioritize those. And then other things like people will come because you are a pillar of your community. I know
Mhm.
I am. People respect me. They want my opinion. They want my time. They want me to do a lot of things. And I feel like I should. And I especially feel that for being a minority because there's not that many of us. And people will say, really, we need you to talk here. We need you to do this. I have to say, does this fit with what's important to me? And if it doesn't, then I don't do it. And it is hard. I do ruminate, but I'm getting better and better each day because it's a practice. It's a skill set that is not inherited us, but we have to practice it. I remember just this past Saturday, I said, today is day. I'm not going to work. I'm not doing anything related to work. And I said, I'm just going to do Christmas and family. Man, I had to focus. I had
Mm.
to focus. We are watching Christmas movies. We are doing Christmas. I'm not doing anything else. And so that's how you do it. You practice it like anything else.
So, as you said, autoimmune diseases are fairly prevalent throughout society. So, for those physicians with autoimmune disorders, is there any way to destigmatize that, bring it out in the open? Because stress, as you said, affects these peoples disproportionately. How can physicians often confront some of the autoimmune conditions that they have and that intersection with the stress that they face?
Well, of course, you do what's appropriate. You medically manage it as it relates to your autoimmune disease. Everybody's course and trajectory is different. We know that, but we don't have to be as stressed as we are. We really don't.
Mhm.
There's another way to do it. There's another way to be a doctor. And I know that I've been in hospital systems, they do count beans, but you can operate and do your job and bring it and bring the conversation to your employer about why it's important to be thorough, to quality over quantity. And there's value in patient satisfaction. And there's value in your well being. Because if you're not well, we are the life force. If we're not well as physicians, then nobody's going to take care of the public. And that's scary to me right now because so many of us have quit after the pandemic. The statistics are all variable, but I know 41% of doctors and nurses left after the pandemic.
Mhm.
And so I think, who's going to take care of me when I get old? So we have to take care of ourselves. It's non negotiable. We have to.
Tell us about some of the conversations that either you've had or you've heard your colleagues have with administration articulating those very points you just said.
So many, right? But a good friend of mine works in the ER, and she says, I like to make sure that I am seeing the patient and giving them proper quality.
Mm.
But my job will come and say I am not putting him through the system fast enough. And then she says I have to say, well, he had this or he had that. And I said, you need to own your space because again, they're not making that. It's hard to make a doctor quickly. And we are in the driver's seat right now. I love that for us, given that there's a shortage. And so you have to have a conversation with your boss, the director, and say, this is why I do these things. And this is the way I'm comfortable to make a practice. If I were to do it differently, I fear I may make mistakes and that would be bad for the hospital and bad for risk management. So I'll continue to do it like this because this is where I operate best. Like this is my zone of genius.
We're talking to Pamela Buchanan. She's a family physician. Today's Kevin MD article is The Hidden Cost of Neglecting Self Care, the Autoimmune Connection. Pamela, let's end with some take home messages that you want to leave with the Kevin MD audience.
I would say my take home is you have to take care of you. There's only one you, and that self care is non negotiable because the cost is too high.
Pamela, thank you so much for sharing your story time and insight. And thanks again for coming on the show.